Joining us tonight, why have I not gotten my vaccine? Why has someone not at risk gotten their vaccine before me?
Now, these are just a couple of questions being asked by Rochester residents as they see some Mayo Clinic employees post pictures to social media after they got their first doses. Our Alex Tejada has been digging deeper, and Alex claims that some of these employees should not be first in line to get their vaccine.
That's true. Tom, Caitlin, the co-lead of Mayo's vaccine distribution program, Dr. Avinash Virk, claims that Mayo has the capacity to vaccinate up to 50,000 people a week. However, with much fewer doses than that being delivered every week, who gets it first is based on who is at the most risk. But she admits that a few telehealth workers might have been vaccinated by accident. However, Virk still assures us that it was not done intentionally and it can be explained by other factors.
The guidance from the state has been changing. It's been evolving. We've been pivoting regularly on a very frequent basis. Right now, I think everything is really dependent on the vaccine supply.
Which means Mayo says it has been prioritizing based on most risk from the start, including back in December when the vaccine was first available.
Whether they were in the ICU or on the medical floors or the lab workers or the custodians who were cleaning the rooms or anybody who was essentially coming in contact with the COVID-19 patients.
But many in the community have pointed to examples of Mayo workers not coming on campus, getting their vaccines before non-Mayo healthcare providers. Such as one anonymous tip to KTTC saying, quote, "I personally know two people who have been given the vaccine that, although they work at Mayo, have zero patient contact. These people are not frontline workers, nor are they essential workers. They clearly fall in phase 3.
It's possible that some people were characterized as being patient-facing or on campus when they may not have been. This process, unfortunately, was not perfect.
The KTTC tip line is flooded with people wanting to remain anonymous, all saying the same thing, blaming any of this over-vaccinating of staff on the confusion and quick pace of the vaccine rollout. Virk also says Mayo was not given any guidance from the state to vaccinate those healthcare workers outside of their operation, but now they're willing to share.
For our own healthcare workers, we get more vaccine, we'll continue vaccinating them, but let's allocate some of these doses for our community members. And so that's what we did. And we are so happy to have them come and get vaccinated this week.
And while state guidance advises vaccinating anyone over 65 years of age, a new pilot program at Mayo starting this week narrows that down.
The guidance that we received was for patients over 80 years of age who live within the counties that we serve.
Virk says all of these appointments are booked for the first week, but Mayo expects to vaccinate about 1,800 people over 80 this week. They do not know how much vaccine will be allotted next week, but hope to finish all 6,000 of their patients over 80, as well as non-Mayo patients in the same age range. How long this will actually take and how smoothly it will be carried out, we'll have to see. Back to you.
Thanks, Alex.